Hey, welcome back to my YouTube channel. So my name's Stacy, and today I'll be talking all about what to expect from MedSurge Clinical. I feel like as new students, we go into MedSurge thinking it's going to be so hard, but we really don't really know what goes on. Nobody really talks about what you're actually doing in MedSurge clinicals. I also wanted to say that every school has a different MedSurge clinical experience. These are just my experiences and just how kind of my clinical went, but it should give you a rough estimate of like what your experiences will be like. So for the first thing, everyone gets a preceptor. Um, you're in groups. They put you in groups, small groups, and then you get a preceptor, and that's your nurse. That's actually going to be your nursing teacher. Basically, she's going to be the one that's going to guide you through med surge. And if you have any questions, you ask her. And your med surge preceptor, I feel like it really makes or breaks your experience. I've been lucky enough to have really great preceptors, and I think that that's like vital for your learning experiences just because then it makes you more comfortable. You can ask more questions. You're not shy if you need something, and just kind of like I feel like you get a better overall experience. So when we went to clinical, it was very important that we were prepared for our patient and we kind of knew what we were going into. Of course, you could ask questions. You didn't need to know 100% every single thing about your patient, but you needed to know the main points and why they were there. Usually, we'd go in and we'd have like a morning huddle, just our preceptor and the other students that were in our clinical, and we'd go over each of our assignments and ask any clarifications if we needed any from our preceptor. In our first semester, that's when we learned how to do vital signs, and that was mainly like one of the most important things that we did as students during clinical. We would go in and we check their vital signs, which include blood pressure, O2 sat, respiratory rate, and just kind of like overall how they're doing, and a bunch of other stuff in the chart depending on where you worked. Um, it got easier with time. You got more comfortable. We would go in and introduce ourselves and kind of tell the patient, like, we're your student nurse today. And if you needed anything, like, we're here to help you. And then you also work alongside with the nurse that's actually assigned to the patient. So it's actually kind of nice. They also help you too, even though they're not your preceptor. We also did a lot of head to toe assessments. So in that first semester, again, we were just getting our feet wet, so we were really learning how to assess patients. And we had a pamphlet that kind of, not a pamphlet, but like a worksheet that had the head to toe assessment and kind of like what you're doing. We had already gone over it in skills lab, but it was nice to have on hand so that you could refer to it if you needed help. And usually your preceptor would do it with you too if you felt uncomfortable or if you needed a little bit more guidance. But as time goes on, you really get really good at these skills. So, like I said, in the first semester, it was heavy on learning how to do the vital signs and head to toe assessment. So, we did that every time we went to clinical. Another thing that you'll most likely be doing every time you go to clinical is a bed bath. Most of the patients are really sick and they need your help to get washed up. And I don't know why, but I think I like wasn't really aware of how that worked. But it's kind of intimidating at first, but then you learn how to do it, and then it becomes kind of like second nature. And you also that's like a lot of people like doing bed baths because that's like the time where the nurses assess for like wounds. They do like just checking the skin and making sure there's nothing new happening to the patient, and just like an overall like assessment of the patient happens during the bed bath, because you get to see the patient's full body. Although it sounds a little intimidating, there's always people to help. You can always do it with another student, another nurse, a CNA. There's always people to help you, especially when it's your first time. Eventually, like I said, you get used to it and you know how to do it, and it's really not that bad. So for the second semester in med-surg, in our school, we focused a lot on giving meds. So that was the semester that now we've got the vital signs down pat, the bed baths, just like the simple things, the simple ADLs out of the way. And then this semester we focused on giving meds. So that went along with, because that was the same semester that we were doing pharmacology, so it kind of went hand in hand. And we were able to give meds. So the day before, our preceptor would pick some patients that had quite a few meds to be given, and we would each take turns. Every week we would switch off on who was giving meds. So it'd be half the group going one week and half the group going the second week. I really liked giving the meds because I think that you kind of, at that point, you understand a lot more things about the nursing role, and it just like ties it all in together when you're seeing the meds and everything, and the care on the floor. In MedSurge, you learn so many things. You're going to see in your actual MedSurge class, you're going to go through so many things, and you're going to think that like maybe you might not touch on some of the subjects that they go over in the MedSurge class, but I feel like you go over like literally like 80% of the material that you went over in MedSurge, like you will see in practice in clinical. It's just like wild to me because there's like so many things that we learn and you literally see all those things, and at first you're getting all this information on your patient, and then you're trying to like, you're trying to be like learn how to become a nurse yourself, and it's very overwhelming at first, but then once you get like, now that I'm in second semester, like everything starts clicking. All the meds start making sense because you know all of them. You start learning all of the abbreviations that they have in there. There's a lot of abbreviations. There's so many. It's like for every single word they have an abbreviation, and you don't learn all of them in school. So you will learn them while being on the floor. There's just so much information that you learn. For example, in skills lab, we learned how to change catheters, put them in, and I did a couple of those. I saw chest tubes. I was able to see someone pull out a chest tube. I was able to um, like, I didn't actually watch it, but you see patients that are on dialysis. I was able to give insulin. There's just like a lot of things that you cover in the class. You see when somebody's fluid overloaded, and then you have to give Lasix, and you just kind of see it comes full circle. You all these things that you learned, all these interventions. I was able to see like you're sitting up patients, so while they're eating, it sounds like common sense, but I feel like when you have all these things coming at you, you get kind of overwhelmed and you forget those basic things. I've also done a one-to-one feed. I've seen like a bladder irrigation. I've used the bladder scans. I've used the Dopplers. I've changed like an ostomy bag. You just see so many things put in practice, and it's just like really eye-opening the amount of things that you learn in MedSurge, and then the amount of things that you can actually apply in MedSurge Clinical, and just how it comes full circle. Oh, and we have a visitor, Rasta. She just can't let me record in peace, so she just came to be nosy. But anyways, hopefully, oh, now she's getting comfortable. Another thing that's like it seems strange about MedSurge is that you see a lot of alarms going off, and you're literally going nuts, like looking all over, like, oh my God, is that my patient? Like if you're not in the patient's room and you're like, oh my God, is that my patient? And then you look up at the board and it's not your patient, and it's just like a lead going off or it's something else. And sometimes nobody even flinches, and you're the only one flinching because there's so many alarms going off, and some of them aren't as important as others, or sometimes they already know what's going on. So you just feel like you're just like always on edge because the alarms keep going off. But really, it's kind of normal to them. I think they know which alarms are the ones they need to pay attention to, but because we're students, we didn't learn all of them, so it's kind of funny. Lastly, your patients. You will have the most amazing patients. Of course, there are some patients that, they're really sick and sometimes they're not as nice as you would like them to be, but for the most part, like you will fall in love with the patients. And sometimes you can make those patients' day. Like I had some patients tell me that I was the best part of their day. And, like it really makes you feel like you're doing something really good and really nice. And especially because we're students, you kind of, because I had only one patient that I was responsible for, you can take that time to really bond with them and ask them questions and just kind of like, hang out with them. Sometimes they just need somebody to talk to. And I found that a lot of times the patients were very lovely, and they just kind of made the job like worth it. These are some of the things to expect in your clinical. I know that all schools aren't the same and a lot of places do different things, but for the most part, this should be very similar to what you'll be experiencing. I really enjoyed MedSurge because I learned a lot and I love to learn, and I also loved meeting the patients. So I'm sure that you'll have a good experience as well. Thank you so much for watching this video, and let me know if you want to see more videos like this in the comments. Don't forget to like, comment, and subscribe if you like this video, and I'll see you guys next time. Peace out.